Joining us now from Washington is Kellyanne Conway, counselor to the President of the United States, Donald Trump. Ms. Conway, thank you for taking some time with us this morning.
It's a pleasure. Hi, Adam.
How are you doing? Well, we know the president is coming here on Monday, and he's going to talk about the opioid crisis. We're also hearing there might be a major policy announcement. We know you can't get too far out in front of the commander-in-chief on that, but can you give us a little preview of what the president is going to say here in Manchester?
I can. This president has been fully committed and in fact has deployed his entire administration to meet him in that commitment, to try to bend the curve in the right direction on what has become truly the crisis next door, the opioid epidemic that is roiling, of course, there in New Hampshire, the second most affected state, Adam, sadly, but all across the country. This is no longer a matter of somebody else's kid, somebody else's coworker, somebody else's community. Everybody knows somebody who's affected, and our local governments are asking for more help. Our first responders, our health professionals, those who run faith-based organizations, treatment centers certainly, and the people at the borders and the Postal Service, our Customs and Border Patrol, they're all asking for more resources. I'm very happy to report that because of this president's leadership and action, the Congress recently came up with $6 billion in opioids funding for fiscal year 2018 for the short-term fiscal bill. That's an historic amount of money for opioids and drug demand, drug supply, and it shows a series of commitment by Capitol Hill and by this president. The president in his policy rollout will emphasize three major fronts: prevention and education, treatment and recovery, and law enforcement and interdiction. And this president is tackling them simultaneously, not sequentially, because they're all important. He's already taken action as president. His cabinet has been incredibly active on the issue, and you see the number of fentanyl dealers that are facing stiffer penalties. The first two Chinese nationals who were indicted by the Department of Justice because of their fentanyl trafficking here. There's no question 64,000 Americans died last year from drug overdoses, a high number of those through opioids, but 20,000 through fentanyl. And I'll bet you most people in New Hampshire and across this country don't even know what fentanyl is. We need to cure this information underload so people understand that over-the-counter drugs that are misused, and of course illicit drugs like fentanyl, heroin, cocaine, things that are illegal, meth, are killing our fellow family and friends and colleagues.
And Councilor Conway, we know that earlier this month the president sort of floated the idea of the possibility of the death penalty for drug dealers. That's something that the people in the drug and treatment and recovery community aren't too keen on, but make the case for these people who are essentially dispensing lethal injections here in New Hampshire and beyond. Why would it be a good idea or a good thing for the opioid crisis if they are in turn put to death?
Well, I don't know why you would think that that's who the president is talking about. That, respectfully, is a complete misinterpretation and misrepresentation of the president's intent and stated words. What the president has said is that we need stiffer penalties for those who are bringing the poison into our communities. The president clearly said on March 1st, when we had a big summit in the East Room here at the White House, that, hey, you got people on death row for killing one person, which itself is a tragedy, but you've got people coming in and they're killing hundreds and hundreds with their drugs, with fentanyl. These are drug traffickers, and they are coming in, and in many cases you don't even trigger the mandatory minimums in the sentencing guidelines because that goes by volume. And you only need about 2 milligrams of fentanyl to provide a lethal dose to one individual. So we're told by law enforcement and interdiction specialists that you need about 20,000 lethal doses to trigger the 40,000 milligrams or 40 grams to trigger those mandatory minimums. So we've seen these cases where some of the drug dealers, the drug traffickers who are bringing a lot of poison, who are doing their business illicitly, they are responsible directly for the deaths of dozens of people in the community or indeed across the state, and not getting the kind of penalties that we're seeing that people think are more appropriate. So I know that makes for a great headline, death penalty for drug dealers, but let's not misinterpret or misrepresent, especially when this president and his commission came up with 56 strong recommendations through a bipartisan commission, all of which were accepted by this president, and many of which are currently being implemented and acted upon.
And obviously the Mexican cartels play a big role in this crisis, but we also have drug makers and companies here at home that have pushed opioids in an effort to make a profit. Now, earlier this month, the president did say that he would like to see a lawsuit at the federal level move forward against the drug makers. He said it will, quote, will happen. And you've got a new Justice Department task force on the job. Why not just file that suit right away?
Yes. Well, the Department of Justice has taken the responsible action of setting up that PIL, as you said, the prescription interdiction or intervention and litigation effort. And I went to that press conference with Attorney General Sessions, and he had attorneys general from the states that were both Democratic and Republican joining with the Attorney General, Jeff Sessions, where he and his department have filed a statement of interest. That is a civil litigation. And a statement of interest really is the first step towards any type of further legal action. I know that they are studying this very closely. But the president's making very clear that if we're going to have prevention and education, say, as the First Lady has also said, we're going to tell our youth to not start in the first place, that they're worth more than the $5 or $10 pill that they're buying on their college campuses, laced with fentanyl, and God forbid they're dead the next day. I've held the grieving families. This is a very real epidemic in your state and elsewhere across the country. But prevention and education also has to go with our prescribers. And if you look at some of the medical curriculum, for many, many years, many of them didn't even include safe prescribing protocols. This was not part of the curriculum. So that's changing. It's changing in many of the states. I know Governor Baker, next door to you, has been on the cutting edge of that as well in his state, in Massachusetts. But this is important too, because our physicians are telling us that when they first, many of them, when they first prescribed opioids, they were told they were not addictive, and of course they are. Also, we have pain as the fifth indicator, which means that in many places they're doing healthcare by emoji. That, hey, unless and until you say you're pain-free when you're getting out of the hospital, some folks are prescribing you more painkillers, and then you give a very high mark to the hospital or the doctor. That has to change. And so I think that the patients are becoming wiser to the fact that pain management need not always mean pain medication or maybe temporary pain medication. And certainly the physicians and pharmacists are as well. We've been very happy with the outreach we've received from pharmaceutical companies, but also the chain drugstores, the community pharmacists, the chemists. And I would note for you that PhRMA, the lobbying organization that represents the pharmaceutical companies, along with some of the major drug stores like Rite Aid and Walmart and Wellmark and the rest, Walgreens, they've come forward and said, we are going to start with a first prescription of 7 days, not 30. That's going to make a huge difference, and we already see a huge difference. The opioid crisis is very tricky. It doesn't begin in the back alley with a needle in your vein. It doesn't just come over the southern border. What happens is it's often in your family's medicine cabinet. And that little bottle of pills is very confusing and tricky because it bears a label that says family doctor and local pharmacy. So if folks are misusing something they know has been legally prescribed for someone else's use, some people don't realize, especially youth don't realize, that they can be harming themselves. And we want to make sure we're getting out the message. But also, this president is very committed, and the dollars are committed towards including not just prevention and interdiction, but also treatment. And this president has already talked about his Department of HHS and the Centers for Medicaid and Medicare Services are already granting IMD waivers to states that want to be able to get Medicaid reimbursement in treatment facilities, which for years were banned because they were mental health facilities. And so there are even rules changes that are happening. HIPAA clarification. We will meet with parents in New Hampshire on Monday that I have met before. And we've heard from too many of them that they had no idea that their son or daughter had an addiction, and by the time that individual was trying to be resuscitated for the fifth and sixth time, they were too far gone. There's a crisis exception in the HIPAA law that allows for a caregiver or a parent to know that their son or daughter, or their grandmother or parent for that matter, are suffering and have had an overdose. And so there are so many different rules changes that can happen and are happening, funding mechanisms, and certainly the most important thing, a presidential call to action for all of us to share our story and to get rid of the stigma and the silence that often attends to this roiling crisis.